All right. Welcome everybody to another episode. I hope everybody had a great Easter and that, those of you who celebrate, if you do not, that's fine too. You know, just over here getting started a little bit. So today we are going to ask home questions that have been submitted by home care agency owners. Now, the two questions we're focusing on are from our Facebook group. All right. So we appreciate those that join. If you're watching this on YouTube, there should be a link to join the Facebook group down below. And we try to do these every Saturday, right around between noon and 2 p.m., just to be consistent, to have some sort of consistency. But if we do make any changes, we will announce them. So thank you all for joining, and those of you who are watching, you know, um, don't forget to like and share this video and subscribe to the channel if you haven't already. Your feedback and your sharing of this information is what keeps us motivated to keep doing these. So we do have a few updates coming up in a few weeks. We're redoing our website. We are we are redoing our website. We are actually going to be making some announcements on upcoming classes for home health, home hospice, and for home care. And some other additional services where the company is growing. Thanks to all of you guys that are watching and those of you who have signed on as clients in some capacity or another. We're growing, we're expanding, and we're trying to find ways to not just service more of you guys, but to be able to provide some offerings at a lower cost for those of you that are just starting out. All right. That being said, let's go ahead and get started with question number one. All right. Let me see if I can bring this up here. All right, so this question was submitted on, it's supposed to say question. Oh, no, there we go. Of course, I messed this all up, so it's all good. Question number one. So Medicaid, it usually only reimburse, no, hold on. If a Medicaid client needs errands or transportation that isn't on their plan of care, can a home care agency charge for it? If yes, how do you bill privately or some other way? Now, this question is paraphrased, all right? It's paraphrased in the sense that, the original asker was in a post and they just kind of they asked too complicated of the way they wrote it was a little complicated. So this is we just reworded it for brevity. So here we go. All right. There it is. It's over here on the bottom for those of you that want to see it. So the short version of this is that all right. So if it's not on directly on the approved PCS, so the Medicaid PCS, your personal care services task list, you cannot bill Medicaid for it. So you have to look at what it is that Medicaid approved. You may, if there's some sort of things in question, you may want to talk to whoever their case manager is, their caseworker, and you'll this way you'll be able to kind of figure out which way to go with it. All right. So if they can't help you, or if it's a service that's just not being done, again, you can't do it. Medicaid is only going to pay for authorized services that are listed on the approved care plan. All right. Now, that being said, as long as your policies and procedures were done properly, and um, as long as you have your service agreement properly done, there you can charge for them privately, charge for those services privately. So what can you do? That well, if your private pay rate is $35 an hour, that's what you're going to do. You're going to just bill for those services as long as they are conducted either before or after the time that you're finished with the client according to their Medicaid personal care services list. All right, their approved services. You cannot bill for it at the same time. You don't want to get caught up in a double billing, double dipping. All right, that's very bad and it can get you in a lot of trouble. So how do you do this? Well, if the family or the client agrees, what you want to do is you want to clearly explain to them what it is that Medicaid does and does not cover, and show them their personal care services plan. Okay, then you want to make sure they sign a agreement. So this way you're getting written consent for these private pay services. And finally, you want to make sure, like I already mentioned, you don't want to double dip. Make sure that you bill separately through that agreement. Don't ever mix it together. And absolutely, and you'll those of you that do know me, those of you that have watched this for a while, you must properly document everything. You guys have should be using some sort of scheduling software, Smart Care or Care Switch or Swift Ops or Clear Care. I think now it's called WellSky. There's a number of companies out there, Access Care, bunch of companies out there that you can actually use to do this. And in the client notes, you want to make sure that you have a start of date for your Medicaid services and a start of date for your private pay services. You want to make sure that your scheduling codes or service codes that you're putting in for the type of service is very clearly defined, and that they are very clearly that the caregiver punched out for a Medicaid shift and punched back in, even if you set it up to do an automatic punch out, punch in at a certain time. That's how you want to make sure it's being done and that the payer source is clearly identified. You know, when all of this is done, that as long as you're properly documenting it all, you should be able to stay compliant and avoid any major issues at that point. All right, so is the short version of that is a short version of whether or not you can cover this. I'm trying to find the original question here for those. Here we go. All right. Let me take a look here. That's that. All right. So that question was submitted by Sherry Abraham. Please forgive me if I've mispronounced that at all. It seems like a pretty straightforward name. And the original question is if you're a home care agency and your client receives Medicaid, needs errands done, or wants to be transported somewhere, but it's not on their state PCS approved tasks, can you bill for it? If so, how? And do you just charge them on a private pay basis? So that's it. So Sherry, if you are watching us live, great. I hope this answered your question, and just give us a thumbs up if you did. And if you're watching the replay, either on the Facebook group or on YouTube, we appreciate your submitting questions. That being said, thank you. Those of you that are watching, please do not forget to like, share, and subscribe. Even if you are watching us live on Facebook, please share this video, invite people to the group. Again, participation and people submitting questions and everything like that, that gives us the incentive to keep doing these. It lets us know that the content we are doing is what you guys want to watch. All right. Also, whether you are doing this on our Facebook group or on YouTube, leave a comment below if you have any question or topic that you would like for us to cover. You know, I'm pretty soon. We have a couple of other consultants on staff now, and we are going to be bringing them on to start addressing some of your Medicaid and specific and Medicare questions for home health, hospice, and everything else. So please, we absolutely would love to get some questions from you. All right, let's go ahead and move on to question number two. And all right, let me go ahead and fix this because apparently I did not set myself up properly when I when I did this. All right. So, all right. Question number two. This was submitted by Sharon Malone. All right, so how about topics on what happens during the survey process, attracting private pay clients, and where to get business supplies and caregiver pay rates? So, those of you watching, all right, listen, Sharon, thank you. You have always done a great job commenting on our YouTube channel. We really appreciate your feedback, and keep the questions coming. They are fantastic. So this is a pretty big question. That's why I saved it for last. And those of you that are watching us live, please, if you have any questions, go ahead and drop them in the comments, and we will answer them as we go along if we have time for a third question today. Okay. So we like to keep these usually around 30 minutes or so, but you know, um, I'm willing to always answer more questions as long as people are asking them. All right, so let's start breaking this down piece by piece. The survey process. All right, so when the state comes to do a survey, there could be a state inspector, could be some for accreditation. It's all similar in process. Some may ask for more or less. You have to keep in mind one thing: the person doing the survey, that auditor, is it's a human being. So you can have five people for five different audits, and you will get slightly different processes from each. So just keep that in mind, especially if you're asking a bunch of different people, which a lot of others do, and it's your first survey and you don't know what to expect. Just keep that always in mind, that as long as your stuff is right, you're not going to have an issue, and just roll with it. All right, but what basically they're going to do is they're going to come in and they're going to look over your policies, procedures, okay? They're going to look over your specific client files. Now, this varies from state to state which client files they're going to want access to. If you are in most states actually, if you have Medicaid clients, the state has access to the database. They're going to come in more often than not always, but more often than not. They're going to ask for specific client files that they want to see because they've already come prepared. They know who your clients are when it's Medicaid. Now, when it's VA, unless it's specifically a VA auditor or surveyor, they're really not going to. The state's really not going to ask you for that. But your VA rep, the auditor from there, the surveyor, will also know exactly who you're caring for, and they will probably ask for specific client files that they want to see, in addition to a few random ones. Okay. They are also going to want to make sure that, they want to make sure your client files are all in order, that you have your start of care in properly, that your case notes, shift notes, all of this stuff is in there. And again, as long as you're using um, a solid system for EHR, electronic health records, electronic medical records, it's all built into your scheduling software a lot of times, and it's all HIPAA compliant. And right now, I can't. I, I mean, I may be wrong. And again, those of you, please leave it in the comments and correct me if I am if I'm not right on this. But I believe all states in the U.S. are currently accepting that you put your information into your scheduling software as long as it is a HIPAA compliant EHR. All right, so you put all of this stuff in, they'll take a look. You'll just show them what you want to. Um, Sometimes, I'm still a little bit old school. I do believe in maintaining proper client charts on paper. All right. It's a great backup, number one. Number two, it does minimize HIPAA violations. And number three, when surveyors come, it makes life a lot easier just for them to tell you what names or for you to go to your filing cabinet and pull out some files rather than, if you get a surveyor that wants you to print everything out. All right. So it's really going to depend. That's my preference. Um, a good tip for this is to make sure that you create a mock client chart and a mock caregiver chart that's properly set up. You do this once, and now you can just make every single chart look like this. Um, Keep a checklist of what items need to be collected and where they're stored. All right, because this way it does a number of things. Number one, it sets up a great system where any new employee or any person that's not normally doing that can just go back and reference and make sure your charts are in order. It does help the surveyor. And if you need somebody to come in and do a mock audit for you, just reach out to us. Medicaid, Medicare, or private pay or VA, we can arrange that on site or off site. All right. So the next thing that they're going to want to see is your caregiver training records. This is where a lot of people get dings. You know, um, if you even if you're using a company like Care Academy, Relias, or one of the other many companies out there that track caregiver training. All right. Um, so the whole thing with this is very simple. You know, while they you know while you may assign your caregivers this work, they want to see typically above an 80% completion rate in order for you to maintain compliance. All right, but your goal should always be a 100% completion. And the big issue that caregiver agencies, your home care agencies, even home health, and even a couple of projects I've worked on with skilled nursing facilities, it's the same issue all the way across the board. You can assign it, but people will drop the ball when it comes to making sure these trainings and in services are being done. So, that's something else that they really want to see. They want, so again, to recap so far, they want to make sure that your policies are in order and up to date. Please, if you're not having your policies and procedures reviewed yearly, your compliance ones, I'm not talking about your operational ones, your compliance ones specifically, make sure that they are being reviewed. Make sure that your client files are in order. Client and caregivers should have paper charts and checklists associated with it. Not that the state necessarily requires you to have paper charts, it's just for ease. Rewind the video a little bit if you missed it, and you'll hear my explanation for this. They want to make sure that your caregiver training records are all up to date. Same thing with, the same thing you want to make sure when it comes to your regulatory compliance and standards. So that means all if you're in a state that requires caregiver training, nurse training, LPN training, that if you have to have maintain certain courses, if you have any certifications that need to be updated, make sure that you are setting up your scheduling software property and flat properly and flagging these things. If your scheduling software does not have reminders and flags that and alerts when people's information needs to be updated, please go look into a project management software like Monday or Asana or Trello, or there's a number of them out there, Basecamp, that they vary in price. Some start with free, they go all the way up to thousands a month. Find something, some way to that you can make sure that all of this is up to date. Your licensing, certifications. If your caregivers drive around your clients, make sure that the driver's license is up to date. Make sure that you have their most current and up to date insurance card. Make sure that if you are relying on your caregivers to drive your clients, this is not something that's often talked about, but make sure you have some sort of vehicle maintenance or readiness, some document of some sort from your caregivers. If it's a newer car, they should be taking the car in to go get regular maintenance. It's not that big of a deal. You can always reach out to us. In fact, I think I will, if I remember, I'll go over this on another one of these sessions where if somewhere I'll post a link to the video. But when we had our conversation with our resident insurance expert, Peter Frey, we went over this. We talked about this. There's a lot of risk and a lot of things involved when it comes to your caregivers driving people around. So you want to make sure that you're mitigating that risk by making sure that all of these things are in compliance. So just to wrap it up, when it comes to the survey process, it doesn't matter whether it's, Medicaid, Medicare, VA, or just a regular compliance audit for accreditation or for state survey, they're going to focus on compliance, safety, and clients' rights. Okay, so make sure your stuff's in order. Next part of the question, where how do you attract private pay clients? Well, we've done lots of videos on this, so if you aren't already subscribed to our YouTube channel, please look it up. It's the morning meeting, all right, on YouTube. Now, not the morning meeting, I'm sorry, Home Care Owners Corner. I forgot I changed the channel title. Yeah, it's Home Care Owners Corner. You can find us on YouTube. I'm sure there's a bunch of links in our Facebook group if you haven't seen it already. All right, and here's what it comes down to. Well, there's a lot of videos there, but if you want to, I don't care if you're doing Medicaid, Medicare, if you're doing hospice, home health, private pay, VA, it's all the same thing. People build relationships. All right. So your people in your office, you yourself, whoever it is, will build relationships with people in all these places. Those relationships, the stronger they get, they will build your business. So when it comes to attracting private pay clients, yes, SEO is a part of the puzzle. Yes, buying leads from lead generators like Karen Holmes, Place for Mom, caring.com, so on and so on and so on, all the ones that are out there. That is a part of the formula. But at the end of the day, you want to make sure that you're building these strong relationships. Hospitals, elder law attorneys, short-term inpatient rehabs, also known as skilled nursing, senior living communities, assisted living communities. You want to start doing community showcases and events. You want to bring people to you. You want to co-market with people. You want to make sure at the end of the day of a couple of things. Number one, you want to make sure you have strong referral relationships. I cannot stress that enough. It When it comes to operating your business, running it smoothly, or even if you're trying to prepare your business for sale, those strong relationships and those ties to those referral partners are what's going to give you the most bang for your buck. You know, um, Uh, Overall, while hiring a professional business developer or marketer can be a little bit costly if you're a newer agency, in the long run, the ROI is usually a lot better than what you will spend on the digital side. Again, it's a marketing mix. SEO is important. Buying digital leads is important from lead providers, but the most important part, the biggest foundational part of this are your referral relationships. So you want to make sure that that's the first part. The second, so lead generation is the first part. The second part is you want to make sure your messaging is on point. How do your services add value and peace of mind? I don't care who you're talking to. It could be a referral partner, it could be a family, it could be little Timmy down the street. If people ask you, hey, what do? You have to be able to answer that. Okay? You need to be able to answer clearly and concisely. There's a big difference between saying, I have a home care agency versus saying, we have a home care agency that focuses on value driven care and in the Medicaid market, or we have a private pay home care agency that specifically caters to those with Alzheimer's and dementia or recovery from orthopedic issues such as hip knee replacements, or we specialize in the in working with those in the recovery process for strokes or other cardiac issues. That's what you need to focus on. Identify who your client is, build these relationships, cater to them properly. And when the biggest hang up that people have is, oh, but it's so hard to get a hold of these social workers. That's plan A. All right. Plan B, very simply, should be, let's take a look at who else is in the building. All right. Remember, there are many, many letters to the alphabet. All right. So keep moving down the pipe. You have your social worker. If social workers aren't responsive, let's talk to the nurses. If the nurses aren't responsive, let's talk to the admissions office. Let's talk to the business department. Let's talk to the administrator or the executive director. Let's talk to whoever we need to figure this out. All of that has failed. We still can't get referrals out of the building. Let's figure out which hospice and home health company or durable medical equipment provider has close connections to that facility. Let's now create a partnership with them and then have them do the soft introduction. Because if I am a trusted partner and I bring you, who is not a trusted partner, into the meeting as my trusted partner, now they will look at you much more um, respectfully and with in a different light than if you walked in on your own. So just remember, bunch of letters, 26 letters in the alphabet. Plan A is only one. You need to move on until something works. All right. Be persistent, be respectful. And one of the things that always gets me a lot of slack is be respectful, always professional and respectful, but never show these referral partners so much respect that you are grateful for their attention. Have gratitude, be gracious, but they're not the be all end all. The honest truth is, most of them are going to be gone somewhere between 9 and 24 months anyway, and you're going to have to reintroduce yourself to the next one coming in. So as long as you're able to provide value, you're going to eliminate the need to kiss anyone's ass. All right. Provide the value, get these introductions. If the person that you're trying to get a hold of isn't accepting of the value you're providing, find a way, to flank them. Get that other referral partner that they are working with and let them vouch for you. Okay. So that's that. All right, that is attracting private pay clients. Short version of it because we got to move on. We still have a couple more other things. So, where to get business supplies? So, there's a lot. Amazon I find is great. If you're trying to build business credit, you can go to a Proline or you can go to Staples, Office Depot. Try to get lines of credit for your business. Don't get it in your own personal credit. Get it with get a business line of credit using your EIN. There's some Medicaid programs that have provide vendors lists. One of the nice things, especially if you're private pay, that you can do is you can go online and buy the gloves for your caregivers in bulk. And what you can do is one of the things, it's a retention trick for me when I've had my own agencies. The you figure out how many shifts you provide, two pair of gloves per 4 hours. So if your caregiver's working an 8 hour shift, for each 8 hour shift that they're working, you are going to provide four pair of gloves. Make them come into the office. You hand it to them. It helps you build a relationship, good retention. And the other thing we used to do is we used to offer the client the opportunity to buy the cases of gloves from us at wholesale. So if we are, for example, if we're providing, if we have a client that has, let's say, C. diff, and the family just, they want to know what's going on, where's the, where can they go get gloves? They don't want to run out, it's issues. So this is great. Hey, listen, you know what? We don't make any money off of this, but just we'll bill you and we'll take care of ordering it. It is a great additional service that falls under that high touch category, and the clients absolutely appreciate it. Okay, it's one of those things that really will make you stand out. So business supplies, again, Uline, Staples, Office Depot, Amazon. Amazon for Business is fantastic. It's what we use here at Briones Consulting Group. We have a business line of credit with them. So whenever we need stuff for our seminars and workshops, that's usually what we do. We just buy them off of there and then pay the bill to help build our business line of credit. All right. So that's that. That one was relatively simple. All right. So caregiver pay rates. All right, that's the last one. Um, that's the last one that we have under this. All right, give me a moment. Just want to make sure. All right, yeah. So Sharon, your question. Yeah, that's the last one. Caregiver pay rates under your question. So it greatly varies from area to area. For example, your average caregiver in Texas makes like $10 an hour, while your average caregiver in New Jersey makes 18. It really depends. These are very wide ranges. You're not going to pay your Medicaid caregiver the same that you're going to pay your private pay caregiver. Why? Because the funding isn't always there. You have to pay within your ability to charge. All right. So, but if we wanted to take an average, okay, I'm going to say, just based on conversations I have, it's somewhere between 16 and $22 is the average across the country right now. That's the average range. All right. So what you want to make sure though is that your pay rates are competitive enough to attract caregivers. Retention is a whole different animal, but recruitment, this is the way it goes. One thing that I will always caution against, a lot of caregivers will put down on your application, if you're in one of the states that still permit you to ask what they were making before, or if you put down what they of the question of whether or not what they were earning before, what they would like to earn. They're always going to put a little bit higher. So take that with a grain of salt. What the way I usually recommend for my clients when they have this question, and it's actually one of the services we'll do for our clients, is we will call, or we will have them call and mystery shop other agencies. Now, here's some basics on mystery shopping, and this is something that will be very beneficial to you guys. Number one, don't ever use your business or personal cell phone to do these mystery shopping calls. There's a thing called caller ID, and if you're calling from XYZ Home Care to, let's say, Griswold, or Comfort Care or Senior Helpers, the fact is it's going to pop up on somebody's caller ID. So that's just one thing. um, if you're going to mystery shop, at least. I mean, you could always just call and say, "Hey, listen, I'm trying to get some feedback on how the caregiver should get paid." All right, but if you're trying to actually mystery shop, you're pretending you're a caregiver. Don't use your own phone. Okay. The the other big thing I want you guys to keep in mind: if you are a non-franchised agency, please call non-franchised agencies. You want to try to do an apples to apples comparison as often as you can. All right. So if you're calling private pay agencies, if you run a private pay agency, call private pay agencies. The Medicaid agency is not paying the same as you. They have different restrictions on what they can pay and different demands from the caregivers. If you are a franchise unit, please do not try to compare what you're doing to non-franchise units. They don't have to worry about things like royalties and the pool for advertising, regional advertising. They don't have to pay systems fees. It's a different setup. So the expenses, which your operating expenses are different in franchise versus non-franchise. So you don't want to do a comparison directly. What you want to do is get and somewhere between 5 and 7 total agencies. All right. And if you're going to do five, you want to do three that are of the same structure as you. If you are a franchise, you want to call three other franchises. If you're a non franchise, you want to call three non franchised agencies. And then the other two are for the opposite. So if I am a non franchised agency, I want to call three non franchised agencies and two franchises. You do the same thing for caregiver pay as you do for pricing. This will give you a good understanding whether you're overpaying, underpaying, overbilling, or underbilling. All right. So once again, thank you all for joining us, and please do not forget to like, share, and subscribe. You know, this is what lets us know that we're gonna that we you want us to keep doing these videos, and what lets us know, what topics to talk about. Please also leave us a comment if down below somewhere. Let us know what other topics you want us to talk about. We have a ton of information, and we're bringing on. We're going to start expanding to the rest of the team some of these videos, and we're going to be launching a webinar series and things like that very soon. So let's go ahead and let's help us help you guys, and give us some things that you want to hear us talk about. Not everything's important to everybody, and we'll take every question with a grain of salt. So thank you again for joining us, and you know um just have a great weekend, and we'll see you again real soon.